stroke occurs when there is a sudden loss of blood supply to a part of the brain. This can be caused by a burst blood vessel, hemorrhage, or a blocked blood vessel, ischemic stroke. How the stroke survivor is affected will depend on which part of the brain is damaged by the stroke. This video will talk about appropriate positioning of stroke survivors. Around 80% of people with a stroke have weakness down one side of the body. This is called hemiplegia. They may also have other problems which affect movement, such as lack of sensation, poor awareness of one side of their body, pain, confusion, or agitation. Lying in an inappropriate position for a long period of time can lead to skin breakdown, breathing problems, digestive problems, joint stiffness and damage, shortening of muscles, and pain. It can also be difficult for someone to engage in the rehabilitation, for example to communicate with others or to use their arms for functions such as eating and dressing if they are poorly positioned. When a stroke survivor is in bed or in a chair, the affected side should always be supported. Use a blanket or pillow to support their arm and leg into comfortable positions. After a stroke, the muscles around the shoulder may be very weak. This puts a stroke survivor at risk of shoulder damage and pain. Never let a weak arm hang unsupported. Never pull on a weak arm, as you may damage the shoulder, causing long-term pain. If someone is not able to move themselves, they should be supported to change position at least every 2 hours. Getting out of bed is important for recovery. The stroke survivor may only be able to manage a very short period of time, but gradually increase the time they are sat out for. If the individual is unable to get out of bed due to their stroke or fatigue, then positioning a good upright posture in bed is a good way to start. If getting out of bed, find a chair that is supportive. Ideally, the chair will be firm with a high back and arms either side. If someone does not have adequate sitting balance, then the stroke survivor may require more specialist seating to enable them to maintain a good upright posture. In order to get the most appropriate seating, it would be advised to get advice from the therapy team. The best way for someone to move should be safe and allow them to be as active and involved as possible. Equipment may be helpful if it's available. The stroke survivor and their family should be educated and advice should be given. Think what it would be like if you were relying on others to help you move. How would you feel? Positioning, support, sitting, active movement.